Donald Trump is linking Tylenol during pregnancy to autism, and he says a drug called leucovorin is a possible treatment for it. Dr. Christopher Labos joins us. Hi, Chris.
Hi, mates.
So, Chris, is there any evidence that Tylenol is a risk for autism?
In a short answer, no. It is probably the only safe medication to take during pregnancy if you're experiencing pain and fever. It is widely used, and pretty much every medical society has come out in the past 24 hours to say that the president is wrong and that Tylenol definitely does not link to autism.
So where does this idea come from?
Well, it unfortunately comes from some fairly low quality studies, studies that have not really adjusted for third party variables that can influence the result. And unfortunately, the president and RFK Jr. and all the people in that administration are usually very good at cherry picking studies and ignoring the stuff that doesn't fit with their narrative. So you have some very poor quality studies suggesting a link. You have much better, good quality studies showing that it is completely safe, and they just choose to ignore the good studies and just unfortunately focus on the bad ones.
And I guess the problem here is this is going to scare women who are pregnant to stay away from Tylenol, and that is an unfortunate thing. As you say, it's very safe.
Well, yeah, and here's the problem. Pregnant women do get sick during pregnancy, right? They get fevers, they get headaches. These things need to be treated. And the problem with a lot of the other over-the-counter medications that are out there, things like Advil, Aleve, right, stuff that contains ibuprofen, naproxen, this group of medications called non-steroidal anti-inflammatories have a number of health problems associated with them. Even in the general population, they increase your blood pressure, they cause stomach ulcers, and specifically in pregnant women, they reduce the amount of amniotic fluid. They lead to a condition called oligohydramnios. They can damage the kidneys in the fetus and the baby. So there's a lot of problems with them. So if you are pregnant and you need pain relief, fever control, frankly, Tylenol acetaminophen is your safer option. And it's unfortunate and a little bit worrisome that the president's remarks might actually drive some women towards the more dangerous option out there, especially if they don't have access to a doctor or a pharmacist who can give them proper medical advice.
Now, I want to ask you about this drug, leucovorin. I don't know if I'm pronouncing it properly, but it's, leucovorin. Donald Trump is talking about this as somehow something that can cure autism?
Right. So where this is coming from is from a small number of studies so let me explain what leucovorin is. It's folinic acid. So it's basically the derivative of folic acid, which is vitamin B9. Now, this medication is used in a number of situations for patients who are taking methotrexate. They might be prescribed it. And it's basically the activated form of folic acid. And where this is coming from is there are a certain number of people who have an adequate amount of folic acid in their body, but an inadequate amount of folic acid in their brain, what's called cerebral folate deficiency. And this is because they've developed antibodies against the receptor that transports folic acid into the brain. And so there have been some studies showing that if you give high doses of folinic acid, leucovorin, you can bypass this receptor, get the folic acid into the brain, and possibly improve cerebral function, which done in children with autism does seem to result in some improvement in verbal scores and self-reported. So there is actually some basis to this, but it's very preliminary science at this point.
Now, from what I understand, it's not really clear what causes autism. And the idea here seems to be that they're saying that autism is a disease that can be cured.
And I think the general consensus is that that's not the way to think about this. I mean, there are, especially the parents of children with autism will tell you that this isn't a disease because there isn't actually anything wrong with these kids. If you were to test them, you would not find any biomedical abnormalities. It's just that their brains work different. And this is where the term of neurodivergence has come from. It's to recognize that these kids are different, but they're not actually sick. And while obviously you want to try to improve their verbal function so that they can perform and integrate into society better and be functionally independent, the idea that this is a disease looking for a cure is sort of philosophically off base. And I think that's the problem that a lot of autism groups have had with Trump's press conference.
Okay. Thank you very much for this, Chris.
My pleasure. Take care.